Let me ask you something personal, but important. When was the last time you truly felt in control of your erection? If the answer makes you uncomfortable, you're not alone. Many men silently deal with performance issues that can impact not only their confidence, but also their relationships and overall quality of life. The good news? There's a natural, science-backed way to regain that control, and it all starts with understanding how your body works. Today, we're going to cover two simple but powerful exercises that have been scientifically proven to boost blood flow, stimulate penile tissue, and help restore or even improve erectile function. No gimmicks, no pills, just pure vascular health, because your erection is not just about libido, it's about circulation. Let's get one thing clear: an erection is, at its core, a vascular event. When you're sexually stimulated, your brain signals the release of nitric oxide in the penis. This relaxes smooth muscles and allows blood to surge into the corpora cavernosa, two sponge-like regions of erectile tissue. These tissues fill with blood, expand, and trap the blood, maintaining rigidity. Now here's where many people get it wrong. If the arteries that supply this blood, especially the pudendal and cavernous arteries, are blocked, damaged, or underused, the entire process breaks down. Without good vascular function, you get weak erections or none at all. Even worse, if the penis isn't used regularly, the tissues can start to atrophy, a process known as penile disuse. Over time, this can lead to fibrosis or even physical shortening of the penis. Yes, that's real. But here's the exciting part. There are specific exercises that can actually reverse some of these effects. They don't just work out your pelvic area, they rehabilitate it. Let's start with the first one, an underrated powerhouse for male sexual health. This first exercise is known as a Kegel, or more specifically, pelvic floor muscle training. Now, you might associate Kegels with women's health, but research shows they can be just as powerful, if not more, for men, especially when it comes to erectile performance. Here's how it works. Beneath your pelvis, there's a hammock-like group of muscles called the pelvic floor muscles. Among them is the pubococcygeus (PC) muscle, which plays a direct role in controlling erections and ejaculation. When you strengthen this muscle, you increase your ability to maintain firmer erections, delay ejaculation, and even improve urinary and bowel control. In short, it's like giving your sexual health a gym membership. To do a proper Kegel, first you need to identify the right muscle. The easiest way is to try stopping your urine midstream. That muscle you feel tightening? That's the one. Once identified, practice contracting it for 3 to 5 seconds, then relaxing. This counts as 1 repetition. Now let's talk about a simple protocol. 15 repetitions per session. 3 sessions per day. Each contraction lasting 3 to 5 seconds. Do this consistently, and you should start seeing results in about 6 weeks. Some men even report improvements sooner. One key point: this exercise is discreet. You can do it while sitting at your desk, lying in bed, or even during a meeting, though we recommend keeping a straight face. But just because it's simple doesn't mean it's ineffective. In fact, studies have shown that pelvic floor training can be as effective as medication in mild to moderate erectile dysfunction cases. That said, like any muscle group, consistency is everything. And if possible, working with a pelvic health physical therapist can help ensure you're activating the right muscles and progressing safely. But strengthening from the inside is just one side of the coin. Now, let's look at an external tool that's equally effective and scientifically validated. The second tool in our arsenal is the penile vacuum pump, a device often overlooked, yet backed by solid medical science. Originally developed for men recovering from prostate surgery, this tool has become an effective method for promoting penile vascular health in a wide range of situations. Here's how it works. The device consists of a cylinder that fits over the penis and a manual or battery-powered pump that creates a vacuum. This vacuum draws blood into the penis, causing an erection. Now, unlike a natural erection that relies on arterial blood, the pump primarily pulls in venous blood, which is less oxygenated. but that doesn't mean it's ineffective. This influx of blood stretches the erectile tissue, particularly the corpora cavernosa, promoting better oxygenation, elasticity, and blood vessel regeneration over time. In other words, it helps train the tissue to become more responsive and better at holding blood naturally. A common protocol is: use the vacuum pump for 15 to 20 minutes per session. Perform the exercise once a day or every other day, depending on your comfort. Always follow manufacturer guidelines to avoid injury. It's crucial not to overdo it. Too much pressure or prolonged sessions can damage the skin or blood vessels. Also, while some devices include a constriction ring to help maintain an erection during intercourse, many urologists, including myself, don't recommend regular use of the ring due to discomfort and potential circulation issues if left on too long. What's most important is using the vacuum as a training tool, not just a quick fix. Over time, this can significantly improve vascular response and even enhance the effectiveness of oral medications like tadalafil. Now, speaking of vascular response, if you're someone who wants a faster, stronger, and more automatic reaction, there's something else I want to show you. There's a surprising 100% natural 7-second home remedy that's helped over 60,000 men dramatically improve their sexual performance by targeting the real root cause of erectile issues, poor nitric oxide levels. It works differently from exercises and pumps, and the science behind it is honestly fascinating. If you want to supercharge your blood flow and experience firmer, longer-lasting erections without pills or side effects, then point your phone's camera at the QR code on screen right now. Or just click the pinned comment below. It could be exactly what your body has been missing. In fact, the pump is often prescribed in combination with medication as part of penile rehabilitation therapy. Used properly, it's safe, non-invasive, and can be a game changer, especially when combined with pelvic floor training. But before we finish, there's one more thing I want to leave you with. Improving your erections isn't just about performance. It's about reclaiming a part of your identity, your confidence, and your connection with yourself and your partner. The two techniques we've talked about, pelvic floor training and vacuum therapy, are more than just exercises. They are acts of self-care grounded in science, designed to help you regain function, sensation, and control over your body. It's important to remember that results don't happen overnight. Just like going to the gym, building strength, flexibility, and endurance in the penile vascular system takes time. But with consistency, discipline, and a little patience, you can expect real, lasting improvements, not only in your erections, but also in your overall sexual wellness and self-esteem. These methods are especially valuable if you're dealing with erectile issues related to age, stress, sedentary lifestyle, or medical conditions like diabetes or post-surgical recovery. By proactively improving blood flow and tissue health, you're not just fixing a problem, you're preventing future decline. Many men feel powerless when their erections start to change. But you don't have to just accept it. You now have two proven strategies that can help you take back control. Whether you start with Kegels, the vacuum pump, or both, you're making a smart investment in your long-term health. And if you ever feel unsure about your technique or results, don't hesitate to consult a qualified healthcare provider or pelvic floor specialist. Sometimes, a bit of professional guidance can make all the difference. Above all, remember this: sexual health is not a luxury. It's a vital part of your well-being. You deserve to feel strong, confident, and connected to your body. These exercises aren't just about erections. They're about restoring a part of yourself that might have been quietly fading. Start today. Stay consistent. And give your body the support it needs to thrive from the inside out.